So we finished treating him, and now we use the same precision mobility tests. They're called spring tests. And so I'm hooking underneath his hip bone, and I'm able to push now and take up the slack. There is actual movement, and then it comes to a natural stop called taking up the slack. And then I spring it, and there's additional spring mobility and recoil. And now at the top of his pelvis, I can push into forward rotation, and there's motion. It comes to a natural stop called taking up the slack. And then I can spring it with an additional force, and it moves. And now I'm coming underneath the ILA of the sacrum, and I can push and it moves. Comes to a natural stop. Then I can spring it, and I can induce additional mobility. There's a forward spring and a recoil. And now I come on top of that lower quadrant of the sacrum on the left, and I can push, and there is movement there, and it comes to a distinct stop, and then I can add the spring test, and now I add a little thrust, and it springs forward and it recoils back. So motion is restored. And so the passive spring motion tests are very important when you're looking at alignment, because again, in this example, visually his pelvis looked like it was aligned, but there was a motion dysfunction, blocked mobility in a couple of directions. And so I'm a real advocate of the passive spring tests, and I certainly have lots of YouTube videos on the spring tests that you can find using my name, Jerry Hesch. Last name is spelled H-E-S like Sam, C-H. And then you could do sacroiliac mobility. You could also type sacroiliac spring tests and sacroiliac joint dysfunction, and you'll find lots of videos that demonstrate the spring testing.